Well, hello again. I'm Bill Russell, president of Lake Norman Chamber of Commerce, and we have another episode of Around the Lake. Today we have Jennifer Varnum. She is the assistant director at Rehabilitation Services at Lake Norman Regional Medical Center, and you've got some exciting news coming your way.
I do. Yeah.
Tell us about it.
We are opening a cardiac rehab program at Lake Norman Regional. This will be the first cardiac program in Mooresville and the first program at Lake Norman Regional.
Jennifer, we have a long relationship, storied relationship with Lake Norman Regional Medical Center. I arrived at the chamber in 1996, and they have always been a tremendous healthcare partner serving our region. But let me ask you a question. Exactly what is a cardiac rehab and who can go?
Yeah, that's a great question, Bill. So cardiac rehab is specifically for people who have undergone some type of cardiac dysfunction or surgery. So after a heart attack is the big one that you think of, but also after you might have had a stent placed or a bypass surgery or valve replacement. But it can also be for people who have things like chest pain, stable angina, as we call it, or peripheral vascular disease in their legs and extremities that make it difficult to exercise and walk. But it is for people with these medical diagnoses. So it's a little bit different than signing up for your regular health club, where you can kind of go in and take a class and do regular exercise. This is a program that is prescribed by your physician, and you are monitored on the cardiac telemetry system during your exercise, and you're taught how to exercise safely. And then we progress you through an exercise program, not only to include the cardiac side of it with, walking on the treadmill, riding the bicycle, the cardiovascular portion, but we also include strength training to actually help you get back to functional life activities.
And this is new to Lake Norman Regional Medical Center. When is it coming?
So we expect to be up and running by October 1st. We're just crossing our T's and dotting our I's with the state to make sure we're in full compliance with the program, but we will have it up and running here in the next couple weeks.
Now, I think everybody knows where the hospital is, but for newcomers, where is Lake Norman Regional Medical Center located?
Well, for newcomers, it is off of Fairview Road, but this program is in the medical office building, which is off Medical Park Drive. And so it's in the building that's attached to the hospital. That there are several physicians' offices there, and we are actually right next to one of the cardiology offices there, which is a tenet of the program because we have to be near the cardiologist and the emergency room in case we have any issues.
Are there any other cardiac rehab facilities like this in Mooresville, Lake Norman region?
So there are no others in Mooresville. We did have the program at Davis Regional in Statesville for the last 26 years. And we're very proud of the program there. Iredell Memorial does have a program still in Statesville. And there are programs down in Huntersville with Novant as well. But this is the first program that will actually be seated in Mooresville.
How will this help the citizens of Lake Norman and Mooresville in particular?
That's a great question. And it's not just for people who necessarily received cardiac intervention at Lake Norman Regional. It can be, if somebody had a heart attack and let's say they were transferred to Atrium or Novant or to Baptist in Winston, but they live in Mooresville, so they don't want to drive to Charlotte or to Winston to exercise 3 days a week. Now they have the ability to do that safely at Mooresville.
Jennifer, how long have you been affiliated with Lake Norman Regional Medical Center?
So I've been affiliated with both Davis Regional and Lake Norman. Davis Regional for over 20 years. I've been a director of the cardiac rehab program there for the last 11 years. And recently, just here in the last couple months, have come on with Lake Norman Regional.
What attracted you to the healthcare industry?
That's a long
Go
that's a
ahead.
long question, but I always knew that I wanted to be a physical therapist, and so by trade I am a physical therapist, and also ran the physical therapy program at Davis Regional, and now will assist with a program at Fern Creek up in Statesville as well. And what drew me into it was I had a love, and I love to work with performance athletes, dancers, gymnasts, and that's where I originally started my career, back up in the Northern Virginia, Washington, D.C. area. And my husband moved me to Charlotte 20 years ago, and then to Mooresville. And so I found my way and my home and my family here with the staff at Davis Regional and Lake Norman. So yeah, I've been doing it for a long time. But what we really enjoy with this program is that we get to know these people. We get to, it's not like a doctor's visit where you're just in there for 15 minutes. I mean, they're coming in, the visits last about an hour, and we're seeing them 3 times a week. So we really get to know these patients and can really see them, make changes in their lives, make changes in their health, make changes in their fitness, and really impact their lives. So it does make you feel really good as a clinician.
Jennifer, if you were speaking to some high school students, we have a outstanding junior leadership Lake Norman program for high school juniors. And if you were speaking to some high school students, perhaps the seniors looking at healthcare as a career, what would you say to them is the reason that somebody should look to the healthcare industry for their job?
So, well, I would say it's a decision that's not taken lightly these days, because there are a lot of costs associated with going into the healthcare field. But it really is for that person who has a deep sense of drive and skill and passion, and who wants to help somebody. I think one of my favorite parts of it is that I'm not stuck behind a desk all day long. I'm moving, I'm interacting with patients, doing a variety of things throughout the day. So it's not just one task. It's very dynamic, and it's just super rewarding to see your patient who might come in at wheelchair level, and in a couple months you have them walking independently or living on their own again independently. So I still do highly encourage the profession, as I still think we have a lot to offer.
I can see you love what you do.
I do.
You live in Davidson.
I do live in Davidson. Yes. We love Davidson. We've been in the Lake Norman area the whole 20 years, but we've bounced around a little bit from Mooresville to Cornelius to Huntersville, and now back in Davidson for several years. Being from the Northern Virginia, DC area, love that historical feel of Davidson. We love the small town feel as well. We can drop our teenagers off and they can go grab something to eat at the soda shop, or, go get some ice cream at Witt's on their own. And it's just a darling place to live.
It is. I have really enjoyed living in the Lake Norman region, and you're exactly right. Davidson has a small town charm, and however, they're becoming renowned for the restaurants that are really coming into Davidson.
Absolutely. Yeah. And if we say, the kids will say, we want to go out to eat, and we'll say, we can only go to Davidson. We're not driving anywhere else. But we have such amazing choices in Davidson, and really appreciate how diverse the choices are in Davidson.
Jennifer, any other exciting news about Lake Norman Regional Medical Center or Davis Regional?
There are a lot of exciting things going on. As many know, we're transitioning to a behavioral health facility at Davis Regional. And I think there'll be more to come on that later. That's not really something that myself or my department can speak on, but we are just so happy for the opportunity that we have had to grow this program, to bring cardiac to the Mooresville area, to help build the footprint of cardiology and cardiac rehab in Mooresville. And we're excited for the opportunity for growth in the area.
Well, I'll tell you, I really appreciate you spending time today talking about this exciting news that you have from Lake Norman Regional Medical Center. And thank everybody for joining us. We want to thank Joe Vagnone, too, a local business broker who's responsible for the presentation of this program. So, Jennifer, thank you for the time, and thank everybody for watching.
Thank you, Bill. Have a great day.